All right, guys, welcome to episode 45. Identify deficits that may impede patient safety. All right, so what do we mean when we say deficits? What we're talking about are things like visual, hearing, sensory, perceptual deficits on a patient's side, on a patient that will impede safety. So let's talk about what this looks like practically. Does the patient... real simple one. Can they see well enough to see what's in front of them while they're walking? When they're walking, can they see if they're about to trip over something? Can they see their cane and where they're putting their cane? Can they see far enough ahead? Are they able to like cross a road and see the is their visual quality enough where they could see cars going by? Or can they see enough to be able to tell if they're taking the right medication? That's a big one, Can they identify their different meds? Vision's a big one. But what I see kind of more frequently than visual issues is hearing. Can they hear someone speaking to them or yelling at them? I've had a lot of patients that are HOH, hard of hearing, and those hearing aids are expensive, and I understand it, but patients' families typically take their hearing aids home because they don't want them to get lost, which I totally understand, but then the patient cannot hear anyone talking to them, so you have to yell at them, and then that compromises HIPAA, and it's just a train wreck. One time, guys, this is just like, I laugh when I think about this. I had two patients in this hospital room, because it was their semi-private. This was a while ago. I don't think they're like this anymore, but there were two patients in a room, and they were both older males, and they were both hard of hearing. So I had to yell at them for normal communication, and I will not yell over this podcast and like startle you while you're driving, but if you could just picture these two older guys, I don't remember at this point what they were in the hospital for at all, but two older guys, both hard of hearing, neither had their hearing aids, and their beds are like, 6 feet apart, not that far apart, and I'm like, Mr. Smith, how's your pain? What? And, they're like, and then, so I'm screaming in this guy's ears, do you have to have a bowel movement? And then I would say, it's like as soon as I would be able to say something loud enough for this guy to hear me, his roommate 6 feet away would hear me thinking I'm talking to him, but he couldn't hear what I was saying, so he'd say, then I'd hear, what? from the other side of the curtain, and it was just an absolute circus. I felt like I was in the middle of this SNL skit where, what? Bowel movement? Like, and he's yelling in response, and you guys, it was very frustrating. And of course, they were both my patient, and and I think, what was it? I can't remember what it was, but they all started they both had, maybe it was grandkids or great grandkids or different kinds of cars or something, but it might have been kids. I don't know. Starts listing out their grandkids. I think one of them listed out all of his grandkids, which was like 10. So his hard of hearing guy is yelling to me the names of his grandchildren. And then the next patient, and so that took forever. I'm like, oh my gosh. And then I go to the other guy, and he tells me, I think his sister or one of his own siblings was in the room with him. Like, oh, you got any more siblings? just making small talk. Oh, I'm one of 13. And I'm like, wow. And he starts naming out all of his siblings. I was like in that room for like 3 hours just to pass like 4 meds and take one of them to the bathroom, guys. It was, I'm like crying laughing thinking of it. Okay, so basically, a lot of patients are hard of hearing. But the main thing is, could they hear if they were about to walk or into something dangerous, into the street, or if I was walking with them in the hallway, or they were walking in the hallway and someone told them to watch out, or move over? Could they hear that? And then the final one, sensory or perception. Can they excuse me, can they feel if something's too hot or too cold? You know, patients that maybe diabetic neuropathy, that's a big one. They can't feel a wound on their foot, and maybe they don't have the dexterity to bend down and look at the bottom of their foot. And if you have diabetic neuropathy, those wounds can be get very serious very quickly. They get serious, and then because of the underlying disease process, they don't heal as well. So really important, not just that, but then also if you think about maybe overall, can they feel if the water is too hot or too cold in a bath? Are they going to burn their skin? You know, those kinds of things. So there's various, you know, if you just think of your senses and those kinds of deficits and anticipate deficits that may impede patient safety. So that concludes episode 45, Identify Deficits That May Impede Patient Safety.
This has been another episode of the unofficial NCLEX Prep podcast. To get the massive PDF guide that goes along with this podcast, head over to nrsng.com/NCLEX-Prep. That's nrsng.com/NCLEX-Prep. That's a free download that you can take with you anywhere, and you can basically have this podcast in text format. Our goal here at NRSNG.com is to give you the tools and the confidence that you need to succeed in nursing school, on the NCLEX, and in your life as a nurse. We want you to succeed, and we want you to become part of this movement of nurses that is dedicated and motivated to learning and becoming the best nurse that they can possibly be. My name is John Haas, RN CCRN, and I'm the founder of NRSNG.com, and I sincerely thank you for being here, and I'm so proud of you for taking this step in your journey. Now you know what time it is now. It's time to go out and be your best self today. Happy nursing.